staying in one place is not going to benefit you.
So around like year 2 or 3 of me being like a new doctor, I went to the retirement party of a nurse who had been in the VA healthcare system like over 30 years, maybe like 35 years. It was like between 35 and 40 years. And after, the retirement party was winding down, I went up to her and I was like, how have you lasted in healthcare, particularly in this healthcare system, this long? Because even at that early stage of my career, I was kind of getting an inkling of some of the challenges, just in the healthcare system in general that can make it hard to really have a long career. Particularly, this nurse was she was just a nice person to work with. She was just very kind of energized and motivating. I noticed she had really good boundaries, but she just really seemed to enjoy what she did. So, I'm like, I worked with people even at that point who were very much the opposite. So not only did I want to know how she made it that long, but in the way that she was. And what she told me that has stuck with me all this time, and which is also the wisdom of what this nurse here that I Stitch talked about, is that you have to move around. She said about every 5 or 6 years, she would very intentionally move to a different location. And she had literally worked in almost every part of that hospital, and mostly in mental health. Some what we call on the physical health side, but mostly in mental health. So she had been in substance abuse. She had been in the methadone clinic more specifically, outpatient, inpatient. She had been in administrative roles. And one of the things that was so great about working with her is because she had been in all these different areas. She had a very great systems level understanding of that hospital in general, but particularly mental health and how it operated, just like the needs of the different clinics and areas. And also she knew how to get shit done because she knew some of everybody. Like she knew a little bit of almost any supervisor or colleague. So if you needed a favor or something, she almost always knew who to call to get something done. So she was very valuable in that way, just like her relationship building. And it really made me reflect on, as time went on, how I can't speak for other healthcare professions, but I think particularly as physicians, it just seems like it's more frowned upon if you're moving around, like you're job hopping. Like even if you're in the same hospital system and you're moving to different positions, I just feel like it's like, oh, like either you, like somehow you don't have it together if you're doing that. But this is a piece of wisdom that I wish I could impress upon any person who is entering whatever their profession is, particularly, their healthcare profession, that moving around, I think, can be a cure for burnout. Because just like the individual talked about in her video, you get to learn a lot of new skills and really get to figure out what it is that you like, what you don't like. But I think even more than that is really picking up all these new skills. And even if you don't think a skill that you're learning, it could be something even very basic. She talked about, one of her first jobs out, just learning the basic skills of nursing, but how valuable that ends up being as you try to translate that into other things. And I just want to co-sign that too, because, when I went from being an outpatient and I went to work in a residential setting in an administrative supervisory role, that role that I did for about 3 years opened up so many doors for me. And even though I didn't have that many people reporting to me, just learning the supervisory structure, learning like HR practices, there was so many skills in that role. I couldn't have ever predicted how helpful that would have been for me, even getting my current role now, like several years later. I didn't even think about being in a non-clinical role, working for an insurance company at that juncture, but that very role, that transition, having a title of medical director, directly translated into me getting the medical director role that I have now. So please, if you are a new grad, if you're in medical school, whatever kind of healthcare profession, this is some sage advice and sage wisdom. Don't feel stuck or like you're beholden or obligated to any, particularly if you're in like a hospital system, if you're an employed person, do not feel that you're obligated to anybody, to any place. You're not. You're only obligated to yourself and your goals and what is going to be fulfilling and satisfying to you, and also just what fits your family and what fits your life. You don't owe the hospital system. You don't frankly owe your coworkers. You don't owe anyone else to stay somewhere if it's not a good fit for you.